Welcome to the deep dive. Today, we're taking a closer look at the published work of one specific researcher, Miranda A.V.
That's right. We're starting with the PubMed database,
Yeah.
that big resource from the U.S. National Library of Medicine.
Exactly. And our search turned up 19 publications under this author's name.
19, yeah. And what's pretty striking right away is the time frame. These papers run from 2003 right up to, well, basically now May 2025.
Wow. Okay. So that's over 20 years of research activity.
It really is. It suggests, a long-term sustained involvement in the field, not just a flash in the pan.
That's a significant track record. And looking at the breakdown, the publication rate seems fairly steady, but there's this definite spike in 2021.
Yeah, that peak is noticeable.
Any thoughts on that? I mean, could it be tied to specific events happening then? Maybe a shift in focus?
Well, that's a good question. 2021,
Yeah.
it very likely points towards increased activity, maybe around certain global developments. When you actually look at the titles of these 19 papers, the range of topics is, frankly, quite diverse.
It really is broad, isn't it? There's a definite cluster around COVID-19, which, well, that makes sense given the timing and impact.
Absolutely. You see things like herd immunity in Thailand, vaccine rollout questions in Indonesia, the impact in places like Yemen.
And even co-infection with dengue in Southeast Asia, plus the one we plan to really dig into, mental health after COVID.
Exactly. But it's not just COVID. Miranda A.V.'s research also goes into some pretty different territories, like gene therapy for Angelman syndrome.
Okay.
And work using CRISPR-Cas9,
Yeah.
the gene editing tool potentially for HIV eradication. That's pretty cutting-edge stuff.
Definitely. And then there's the longirvirus outbreak.
Right. So it seems there's this interest in both infectious diseases and also these advanced sort of genetic
It
technologies.
keeps going, too. The African Medicines Agency, medicines regulation, and then this zombie viruses topic. Sounds intriguing.
It does. And biothreats.
So trying to tie this all together, maybe the common thread is looking at these biological research areas, but through the lens of major public health issues.
That feels like a solid interpretation, yeah.
Yeah.
It's a portfolio that really engages with pressing health challenges from multiple angles.
Okay, so to get a better feel for the specifics, let's zoom in on that one article. Mental health in the post-COVID-19 era. Future perspectives.
Good idea. This paper came out in May 2022, and it kicks off by reminding us of that key date, March 11, 2020, when the WHO declared COVID-19 a pandemic.
A date etched in memory for sure. A real turning point.
And the article immediately connects the dots, doesn't it, between the pandemic's chaos, the lockdowns, the uncertainty, job losses, all that, and the pressure on mental health services, which were often already stretched thin.
Right. It wasn't just a physical health crisis, was it? The psychological side was massive right from the start.
Absolutely. The paper highlights this kind of double whammy. You had people developing mental health issues for the first time, and then those with existing conditions often got worse.
Yeah, it really underlines just how deep the psychological impact went.
And the article then breaks down that impact on the general public. It's quite a list. More depression, anxiety, stress, panic disorder, OCD.
Even somatic symptoms like physical pains caused by stress
Oh,
and sleep problems.
exactly. And sadly, more severe things too, like delirium, psychosis, self-harm, and even suicide rates increasing.
And the triggers were everywhere, weren't they? Fear of getting sick, money worries, just the general insecurity, plus all the misinformation flying around.
Yeah, the lack of reliable information was a huge factor. The article mentions things like panic buying, too.
Oh, I remember that well.
But it also digs into something perhaps less visible, how people already dealing with mental health struggles face worsened symptoms, maybe relapses, or increased suicidal thoughts because their support systems got disrupted.
That's such a critical point. Confinement, broken routines, less access to care.
And less access to just, family and friends. Basic social support vanishing overnight for many.
The article mentions studies from China, right? Linking quarantine directly to things like anxiety and insomnia.
It does. And it also points to some of the less healthy ways people cope during lockdowns. Increased substance use, for example.
Or other addictive behaviors, like online gaming, gambling.
Right. And disturbingly, a rise in domestic violence, too. These were all consequences.
And then there's the stigma. Fear of the disease itself actually stopped some people from seeking mental health help when they needed it.
Yeah, that combined with perhaps a lack of trust in authorities or feeling marginalized.
Mm.
It created real barriers.
It really paints a picture of a society under immense strain. What about healthcare workers? The article addresses them specifically.
It does, and it's a crucial section. It highlights the intense, unrelenting pressure they faced.
Constant stress, huge workloads, burnout.
Discrimination sometimes, being separated from their families, the fear of getting infected or infecting loved
Plus
ones.
resource shortages, right?
Mm,
Especially PPE early on.
yeah.
And just dealing with so much severe illness and death.
It's hard to even fully grasp. The paper notes that frontline workers, specifically, were hit hardest. Studies showed higher rates of anxiety and depression among them.
So, facing all that, the article moves into future perspectives. What's the outlook?
Well, it anticipates a pretty significant long-term negative impact on mental health because of things like the economic fallout, maybe lingering social isolation.
So, basically, the demand for mental health services is expected to keep rising globally.
That's the forecast, yeah. Increases in depression, anxiety, substance abuse, potentially suicide rates. It's a sobering picture, but it highlights why planning is essential.
Okay, but it's not all doom and gloom. The article does offer potential solutions, right? Like
Right.
telepsychiatry.
Exactly.
Yeah.
And it presents a balanced view, which is good. It talks about the clear benefits.
Like better access for patients, less travel, maybe lower costs.
Right. And for clinicians, more flexibility may be safer in some contexts.
But it also flags the downsides, like missing nonverbal cues over video, keeping patients engaged remotely,
Yeah.
that kind of thing.
It does acknowledge those challenges, but the overall take seems to be that, look, telepsychiatry is a really valuable tool. It expands reach, can make things more affordable, maybe helps bridge gaps between face-to-face visits.
Makes sense. What else does it suggest for the future, especially for healthcare workers?
It strongly pushes for preventive measures for them. Things like education on coping with stress, making sure psychological support services are actually available.
Mental health apps, maybe? Regular check-ins?
Yes, and early support.
Yeah.
Also suggesting things like group discussions for staff, a space to talk about the pandemic's impact on their work and brainstorm solutions together.
That sounds helpful, fostering a supportive environment.
And things like anonymous online self-check tools, offering tailored feedback, ways to encourage self-awareness without pressure.
What about research? Where should that focus now?
The big call is for longitudinal studies, following people over time to really understand the persistent psychological effects. We need long-term data.
Right, not just snapshots during the crisis.
Exactly. And using reliable data to build strategies, prevention, and treatment that we know are actually evidence-based.
The paper also mentions primary care, doesn't it? Enhancing its role.
It does, making sure primary care doctors feel more equipped, more confident in handling common mental health issues.
And encouraging all healthcare professionals to get some basic training in psychological first aid, like the WHO offers.
Yeah, sort of upskilling everyone to be able to offer initial support.
And community health services, too, training them up.
Right. Giving those local frontline professionals the skills to manage psychological crises, communicate effectively, spot problems early, using online training if needed.
And finally, the big one, stigma. How does the article suggest tackling that?
It says healthcare institutions need systems in place to identify and help patients. But more broadly, it's about normalizing needing help.
Acknowledging that mental health struggles are, well, common, especially after something like this.
Exactly. Teaching basic self-care, simple distress management techniques, encouraging leaders to talk openly about well-being, being mindful of the language used around mental health, all crucial steps.
So the article's conclusion sort of ties this all together.
Pretty much. It sums up by saying, look, we're likely facing a surge in psychiatric illness because ordinary people went through something extraordinary.
And the symptoms could be a whole range, from emotional distress to severe illness, adding to the burden on healthcare systems everywhere.
Right. And the key responses needed are early assessment, better support for healthcare workers, education on self-care, tackling stigma head-on, and expanding services like telepsychiatry.
Okay. So stepping back now, thinking about Miranda A.V.'s work overall, what's the main takeaway from this deep dive?
Well, looking at both the wide range of topics from the PubMed search and the detail in this mental health paper, it really seems Miranda A.V. is deeply engaged with major public health challenges.
Especially where infectious diseases meet broader societal impacts, right? Like the mental health fallout from COVID.
Precisely.
Yeah.
And the focus isn't just on describing the problems. It seems to be also about exploring solutions and thinking about future directions for healthcare.
A proactive approach, maybe, understanding and trying to mitigate the impacts of these big health crises.
That's how it feels, yeah.
This has been really insightful. Considering all those diverse research areas, gene therapy, viruses, mental health, makes you wonder, doesn't it? What other, maybe unexpected areas will be affected by the long-term ripples of events like the pandemic? And how crucial will that kind of cross-disciplinary research be to figure it all out?
That's a fascinating question to leave us with, the interconnectedness of it all.
Definitely food for thought. Thanks for joining us on this deep dive.